another hospital, and the other hospitals would have difficulty accepting these women because the referral paper says it's from a manual hospital. So a patient with severe mental illness who is in labor would go from hospital to hospital in an ambulance, and none of the hospitals would be willing to take that patient in. And there was an incident when one of my patients delivered in the ambulance. So this is in Addis. This is in our hospital setting. This is in the population, or at least in the group that you would expect would have a better awareness of the needs of women with severe mental illness who are pregnant. So if this can happen in a hospital setting among health professionals, you can imagine what would happen in the community setting. So I did a qualitative study. My plan is not to talk in detail about the findings of my study, but I did a qualitative study in just exploring what their experience is like, what it's like to be a woman in a low and middle income setting with severe mental illness and being pregnant at the same time. It was an experience that opened my eye to so many other needs and how relevant it is for us as a woman to take up these, issues and do a research for them. So it's my purpose was not just to study and leave it, but it became a passion for me to make sure that we understand the construct of mental illness and mental illness and mental well-being in women, and to make sure that we have an intervention and a treatment setting and even a policy that's quite sensitive to the peculiar needs of these women. And I found it to be quite an important issue to make sure that how we understand even the experiences, the illnesses of these women should be really relevant to everyone's context. So just to give you an example, one of the participants of my study was a woman who's a mother of 3 children, and she became pregnant with her 4th child while she was also severely mentally ill, and she was quite distressed. And when she became pregnant, her husband abandoned her, and she went back to her family, which were her mother and 2 of her brothers and her father. And so what happened to her was that they said, we're not going to raise a baby that she got from Kamida, Yemen. We're not going to raise that. So while she was pregnant, she got chased out of the house, and she's not in any condition to take care of herself because of her mental condition. And her mother decided to leave the house with her. And they were going from holy water site to another holy water site to another holy water site. But because she was pregnant, they were afraid that she might deliver there, and she was not calm enough for them to keep. So even in the holy water place, she found it difficult to have a safe place for this woman. So the mother brought her child, who was pregnant, to a manual hospital, and the things she was quoting about the experience that they went through together while she was pregnant it's almost inhumane what they went through. And the father and her brothers did not want to be affiliated with her in any way. So this is something that needs to be addressed. Our hospitals need to know what to do when our patients come with pregnancy. And we don't have wards like in the West. There are some setups that have perinatal wards, which means that they have a place for the mother to be treated and for the baby to be kept until she becomes stable. and once she becomes stable, she can give a consent for the child, to be given up for adoption, or she might even choose to take care of her own baby. But in our setting, once the baby is delivered, the mother is assumed to be unfit or is so it's kind of difficult, but it's something that we really need to work on, and we have to be intentional in making sure that we know what the needs are, we understand what they're going through. And another study that I just did is on exploring and understanding the construct of depression in rural women during this perinatal period. So most of us might be familiar with the term postpartum depression and those things. But what I wanted to know is it even recognized as a problem in the rural community? Do people even know that it's quite an abnormal state that requires treatment and intervention? And if they do recognize the problem, how exactly do they experience it? Is it the same type of depression that we have in the West, or is it quite different when it occurs in women in the rural setting? And again, the finding is quite different. The symptoms are quite different, and the kind of perception they have, and even how they, and their own appraisal of what they are going through is quite different from what we call, postpartum depression. And because illness has a lot to do with the cultural context, and how you understand an illness also will define what measures you take to cope with it. So understanding exactly what depression looks like in women, and not just women in this postpartum period in the rural setting, is one of the things that I tried to look at. Coming back to my journey, these studies, they didn't come because I intended to change the lives of women. I'm not like these passionate people here who are, who made this the mission for their lives, their passion. It didn't happen like that for me, but I noticed things. And these are things that are quite relevant, and they affect the lives of women on a daily basis. So I started following that and pursuing that. I wouldn't say that I haven't accomplished much in it, but I do know that whatever I do has to go beyond, the four walls of my clinic. Meaning that I just don't want to see patients, prescribe something, or do therapy, and then send them back home. When I keep seeing a pattern, when I keep seeing some things that are affecting or driving what the patients are going through on a higher level, I would want to make a difference to that extent. So that's why I believe staying in academics is important. As a doctor, I can do clinical practice and do other things on a daily basis. Of course, I can still continue impacting the lives of people I interact with, but I think as women, staying in academics gives us a unique opportunity of addressing things on a higher level. And we often find we often feel the need to follow the path of the least resistance, because you're a physician, you're in academics, and you also have other responsibilities at home. So you would feel like you would want to, if you pursue a career that has less, night calls, if you're a doctor, so less night duties, or in academics, you might just want to stick to the teaching and not do so much research. Even if you do research, you just might want to publish and not do a lot of traveling. You just might want to do a study, just limited to where you are, not apply for bigger grants or not travel a lot. We tend to limit ourselves in that regard. But I feel like going through academics again I feel like if I am in academics, I have to be quite excellent in it. And also another like involving the teaching, my social life, like my marriage and everything. We have set this standard for ourselves that we have to be exceptionally excellent because we are in academics. We have to do better in those things, and those things are good. But at the same time, if we feel like we're not going to be excellent in those things, we choose not to get involved as much. But for me, I don't know, this might work for you, but what worked for me was I tried to do things that are really relevant and that are in alignment with my priorities, with my values, and with my passion. And I tried my best to follow that. And I don't have to be worried that I have to be excellent at everything. You eventually do contribute, you eventually do make a difference if you stay aligned with your passion and if you stay aligned with what you think matters to you. So in terms of what I'm doing in the department, it's just a few months ago. I've been the deputy department head, but it's been 3 probably months since I became the head of the department. And you stretch a lot in terms of time, in terms of managing to do everything in an excellent way at the same time. But I believe it's something we can do, not just because we are women, but because we also have something to contribute. And when it comes to what I call success is, it's not just them. For example, if we are in academics, it's not just growing from assistant professor to associate professor to becoming a full professor. It's not just being able to meet the predefined expectations or going up in some ladder. I believe it's something we can set for ourselves, and I believe being able to pursue what we love and making sure that we get the credit and the recognition that we deserve is, I believe, what success is. And in terms of I think I've spoken about this in terms of what hinders us from going there. I think we have this self-doubt that we feel like we are less competent, or there's always this guilt when we put more time or when we do things related to academic activities. We feel like we're taking away from for spending time with our children, or from some time that we could have given to our other responsibilities. But I believe that you set your priorities, you set your values, and whatever you're contributing to the community in a meaningful way, as long as it's done in balance, at the end of the day, you are still contributing to your family. I would say putting yourself first is important, meaning finding a balance between continuously giving to your families or even to your academics, and that has to be balanced with feeling overwhelmed or overworked at home. So if you find that balance, and I think that balance is quite important for you to be successful even in academics. So putting yourself first means also being able to say no. Some of the things, it's being able to say no is something that I really struggled with, because as a young academician, you have a lot of seniors around you. You look up to them in so many ways. So you get offered a lot of opportunities, and you assume that because they have gone ahead before you, you assume that they know better, and you feel like you have to take up every opportunity that's offered by them. And even if you don't feel like it's really aligning with what you want to do, or if it's not aligned with your area of interest, you feel like you have to take up that responsibility, or you feel like you don't want to be in trouble, or if you reject one opportunity, they're not going to offer you another opportunity. But again, being able to say no is quite important, and make sure that it's an agreement to what you want to pursue and in what you want to do. When it becomes too much, you can say no, and so it's not just being aggressive and taking opportunities, but sometimes it's about taking time, reflecting, and making sure that it's what you want to pursue. Because in academics, there are a lot of opportunities to write, to be funded, to present. You know, you can be misled in any direction. And I would say, put yourself first. Say no when you need to say no, and put yourself forward. So I think I would say that most women believe that success comes out of merit, but not necessarily. I think men are more quite aggressive and quite intentional in their competitive strategies. I'm not saying always have that mindset of being on top and always be competitive, but no one's gonna come knocking at your doors and give you opportunities. So make sure that you put yourself forward, meaning I would encourage everyone to be proactive and intentional in making sure that what you say is heard, and that people know what you're doing and what you are passionate about. So if you put yourself forward and if you are intentional, I believe that's important. Be visible and stay connected. Stay connected meaning, I think women who have mentored me have had a big impact in my life. So having a tribe, for example, is quite important for survival. So if you're a woman, like, mentor other people, be mentored, stay connected. So where you want to go will not just be determined by your intellect or your competence, but also about who knows what you are doing. And so I just want to encourage everyone that I'm not that accomplished, but what I know for sure is that we all don't have to be dealing with issues with women, but so we all don't have to be focused and do with issues with women. But what we have to do, I believe, is that as women, whatever we are doing, if we give it our best in academics, I believe that's leaving a mark for other women to follow. So I'm interested in women's mental health, but if I'm working in other area of mental illness, as a woman, me excelling in the academics will still leave a mark for the other women to follow. So I just want to encourage everyone, you don't have to drop out of academics. You can be excellent in academics, and make sure that you are following a path, a track that at the end of the day you will leave a mark on. So you can do many research, but at the end of the day, if you try to figure out what particular interest in research you have, that at the end of the day will leave a mark for all women to follow. Thank you.